I just felt really welcomed here.
We offer a 2-year fellowship in infectious diseases. This is a comprehensive clinical infectious diseases fellowship. We provide in-depth training not only in clinical care of patients with infectious diseases, but also in infection control, antibiotic stewardship, and multitude of research opportunities here at Brown.
When I came here, there was such an incredible collegiality amongst the faculty. There was a very incredible energy that could be felt with the attendings, the relationship with the fellows. It felt like a very safe learning environment.
I came from a medium-sized residency program in Portland, Oregon, which worked really well for me, and I was looking for something similar in an infectious disease fellowship program. And I really found that here at Brown.
There were a lot of research opportunities, especially in HIV, which is something I'm sort of interested in. But then there were other opportunities if I had interest in them. I just felt like I wasn't limited to one thing. They had so many things I could do.
I saw firsthand the excellent diverse pathology that the ID fellows were exposed to, so I knew if I decided to stay here that I would have excellent clinical training.
So I think the biggest thing is how it feels to you, especially when you see the program and how the faculty work together and faculty work with the fellows and the medical students and the residents. I think that the program here has a lot of good faculty.
I want to be able to kind of bridge the gaps in healthcare between, a developed country like the United States and South Africa. Brown does have this very strong component of global health.
Unmatched clinical diversity in terms of our patients, and our program sits in an area where we have a very large catchment area of patients. We see patients from the whole state of Rhode Island as well as southeastern Massachusetts and northeastern Connecticut. We have excellent research opportunities for fellows. Mentoring starts in year 1 with our research faculty.
My clinical education here was excellent. I knew that staying here I would be well supported by the division and by the Department of Medicine. I felt extremely prepared in making that jump from a fellow to attending physician.
As an infectious disease fellow, you will be very busy in the first month. We do a lot of mentorship, okay, how can you be more efficient so that you're able to spend time at home? You're not working every single weekend, so you're able to have a social life, spend time with your family.
I love Providence. I've really, come to appreciate it even more. I think it strikes a perfect balance of kind of big city amenities, but also a small city feel. I live within 10 minutes of both of the hospitals that we rotate through. I'm within 5 minutes of downtown, and so have access to phenomenal restaurants. I think if I had to choose one thing, that might be it about Providence, especially for a small city, has amazing food.
I really like the New England feel. A lot of things you could do in a city, in Providence, in downtown Providence when you want to, and then when you want to get out of the city, it's really easy within a 5-minute drive to get to beaches, things like that. There's a lot of good experiences that you can do when you have the free time when you're a resident.
I've overall had a really positive experience here. Female as a minority in medicine, this is an awesome place to be. You will be supported. I think that for someone who is looking for an institution that will support them, this is a great place to be.
One of the real hallmarks of our program here at Brown is that we have very high standards for clinical care, for teaching, and for research, but we deliver that in a very collegial and supportive environment, and that's something we take pride in. And I think that really speaks to how we interact with fellows on a regular basis. They're not trainees, but they're our colleagues, and that's really important.
There's many opportunities here, not just for people who want to practice clinical ID. This fellowship really sets you up to have a career path in whatever direction you want. Have never regretted, never looked back, and feel very grateful for the training that I got here.